Welcome to G Fun Facts Online. We all know the mantra, exercise is medicine. It's the single best thing you can do for your health. But what if I told you this potent medicine can also be a poison? That the very activity that protects your heart can also trigger its catastrophic failure? That a pill in a lab is getting closer than ever to bottling the effects of a workout? Today we're diving deep into the Pharmacology-Exercise Paradox, a series of fascinating contradictions that reveal the complex, powerful, and sometimes dangerous relationship between movement, medicine, and our own bodies. Let's get started. The first paradox begins the moment you start your workout. Imagine a graph of your health risk versus how much you exercise. It's not a straight line down, it's a U-shaped curve. The highest risk, of course, is doing nothing. As you start to move, your risk plummets. But at the extreme end, we're talking ultra-marathon levels. The curve can flatten or even tick slightly upward. This leads us to the most dramatic part of the paradox, the acute risk. While a lifetime of being active massively reduces your risk of a heart attack, each individual bout of vigorous exercise transiently increases the immediate risk of having one. This sounds terrifying, but let's be clear. The risk is highest for people who are normally sedentary and suddenly decide to go all out. The surge in heart rate and stress hormones can cause an unstable plaque in an artery to rupture, triggering a heart attack. Now, the absolute risk is incredibly low. We're talking about one sudden cardiac death for every 1.5 million episodes of exertion. The long-term protection you build from consistent exercise far, far outweighs this tiny transient risk. But the paradox remains. The thing that saves you in the long run can be the trigger in the short run. A similar paradox happens at the cellular level. Strenuous exercise is a pro-oxidant activity. It floods your cells with reactive oxygen species, or free radicals, which can damage DNA and proteins. It creates what scientists call metabolic chaos. So how can something that causes cellular damage be so good for you? The answer is a concept called hormesis. A small dose of a stressor triggers a beneficial adaptation. That short burst of oxidative stress during a workout is a signal. It tells your cells to up-armor. In response, your body overcompensates. It doesn't just repair the damage, it builds stronger internal antioxidant defense systems. It's like a controlled fire that, instead of burning the house down, forges a stronger, more fire-resistant structure. The short-term stress of exercise is the very stimulus that builds a more resilient system for the long term. But what happens when this powerful drug has serious adverse effects? This is where pharmacology steps in, not to replace exercise, but to manage its unintended consequences. Take exercise-induced bronchoconstriction, or EIB, often called exercise-induced asthma. For millions of people, intense activity leads to a narrowing of the airways, causing coughing, wheezing, and shortness of breath. The paradox here is that it's not the exercise itself, but the breathing during exercise. When you breathe fast and deep through your mouth, you bypass your nose's ability to warm and humidify the air. This rush of cold, dry air into your lungs triggers the release of inflammatory molecules that cause the airways to constrict. Thankfully, pharmacology offers a toolkit. The first-line approach is often a short-acting beta-2 agonist, like an albuterol inhaler taken a few minutes before exercise. It relaxes the airway muscles, preventing them from constricting. For more persistent cases, daily controller medications like inhaled corticosteroids reduce the underlying inflammation, making the airways less reactive. These drugs effectively diffuse the paradox, allowing people to get all the benefits of exercise without the debilitating respiratory symptoms. Now let's talk about the most tragic manifestation of the exercise paradox: sudden cardiac death in a young, seemingly healthy athlete. It's rare, but devastating. Here, exercise is the acute trigger for a fatal arrhythmia caused by an underlying, often undiagnosed condition. In athletes under 35, the cause is usually a genetic or congenital abnormality. The most common in the US is hypertrophic cardiomyopathy, or HCM, where the heart muscle becomes abnormally thick and prone to dangerous rhythms during exertion. For this, new drugs like aficamten are emerging. It's a cardiac myosin inhibitor that reduces excessive contractions of the heart muscle, improving exercise capacity in patients. In athletes over 35, the cause is almost always underlying coronary artery disease. The pharmacology is all about prevention, managing risk factors with drugs like statins to lower cholesterol and antihypertensives to control blood pressure. So when a person who is already taking medication starts an exercise program, their body becomes a dynamic, changing environment. The physiological tidal wave of a workout, the redirected blood flow, the increased body temperature, the changing pH, can fundamentally alter how a drug works. It's a two-way street. Exercise changes drugs, and drugs change exercise. Let's look at some common examples. First, beta blockers. These are used for high blood pressure and other heart conditions. They work by blocking adrenaline, which slows the heart rate. This creates a direct conflict with exercise, which naturally tries to speed the heart rate up. The result is a blunted heart rate response. A person on a beta blocker will find it impossible to reach their target heart rate. This makes heart rate monitors useless for judging intensity. Instead, they have to rely on the rating of perceived exertion, or RPE scale, judging intensity based on how hard the effort feels. Next, statins. They're brilliant at lowering cholesterol, but their most famous side effect is muscle pain, known as SAMS. Exercise can also cause muscle soreness, creating a clinical puzzle. Can you exercise on statins? For a long time, the concern was that exercise could worsen statin-induced muscle issues. But reassuring new studies show that for the vast majority of patients, moderate-intensity exercise is perfectly safe and doesn't significantly worsen muscle symptoms. It simply requires good communication between the patient and their doctor. What about all those anti-inflammatories, like ibuprofen, that athletes seem to pop like candy? The evidence suggests this is a bad idea. While NSAIDs might reduce the perception of pain, they don't prevent the underlying muscle damage from a workout. More concerningly, they may interfere with the healing process. The inflammation that causes soreness is also a critical signal for muscle repair and growth. By blocking that signal, regular use of NSAIDs after exercise could actually hinder your long-term training gains. Finally, there's the holy grail of this entire field: the quest to bottle the benefits of exercise in a pill. The goal of an exercise mimetic isn't for laziness. It's for the millions of people who physically cannot exercise due to paralysis, frailty, or severe disease. The very existence of this quest is the ultimate proof of how powerful exercise really is. When we exercise, our muscles, liver, and fat tissues talk to each other by releasing hundreds of bioactive molecules into the blood. These are called exerkines, and they are the secret sauce behind exercise's systemic health benefits. For example, contracting muscles release proteins called myokines. One is called interleukin-6. In chronic disease, it's inflammatory. But when released from muscle during exercise, it has powerful anti-inflammatory effects and helps with glucose uptake and fat burning. Another is irisin, which helps turn energy-storing white fat into energy-burning brown fat. The discovery of this internal pharmacy has given scientists a treasure map, revealing the key molecular switches an exercise pill would need to flip. Researchers have zeroed in on a few of these master switches. One is an enzyme called AMPK. It's the cell's master energy sensor. It gets activated when energy is low, like during exercise, and it kicks off a cascade of events to generate more fuel. The common diabetes drug metformin works in part by activating AMPK. In a famous study, sedentary mice treated with a research compound called AICAR, which directly activates AMPK, were able to run 44% further. mimicking the effects of endurance training without ever training. Another target is PPAR-delta, a receptor that turns on genes for building fatigue-resistant muscle fibers. When sedentary mice were given a drug that activates PPAR-delta and they exercised, they became super-endurance mice, able to run almost twice as far as trained mice. This shows how these drugs can work synergistically with exercise. And the research is moving fast. Scientists at the University of Florida recently developed a compound called SLUPP332. In obese mice, it triggered weight loss by ramping up energy expenditure and fat burning, all without the mice moving more or eating less. It's a tantalizing glimpse of the future. But could a pill ever truly replace a run in the park? It's highly unlikely. A single drug targeting one or two pathways will probably never replicate the complex symphony of thousands of molecular changes, the mechanical loading on your bones, and the profound psychological benefits of voluntary movement. In the end, the exercise paradox teaches us that exercise is a drug so powerful that we must treat it with respect. It forces us to be smarter about how we prescribe both movement and medicine. The future isn't about choosing a pill or a workout. It's about a future where your prescription might be for both, intelligently combined. A future where a drug might prime the muscles of a frail patient so they can begin physical therapy, and where your workout schedule and your medication schedule are designed to work in perfect harmony. The paradox doesn't diminish the value of exercise, it elevates it, placing it right at the center of a new, more sophisticated vision of human health.